We are facing the greatest threat that we have faced in New South Wales since the pandemic started.
The Premier says she needs Sydney to be shocked. COVID cases are surging, and tonight the warning, lockdown could be extended. Tough new rules on exercise, shopping, visitors and funerals. We explain what you can and can't do. From Liverpool to Fairfield and Cabramatta, our southwest suburbs feel the full force of the law. Plans for a new quarantine hotel above a childcare centre. And Ash Barty's dream of a Wimbledon title is now just one match away.
This is 9 News with Mark Burrows.
Good evening. Our COVID outbreak is tonight at crisis point. 44 new cases of the Delta strain and a major warning from the Premier. Lockdown might not end next Friday. 5 million people across Greater Sydney and beyond are now under even tougher restrictions to avert what authorities fear, an explosion in cases across the suburbs.
Police patrolling the streets of Fairfield as the Premier led a solemn march. On the day the lockdown was scheduled to end, 44 new cases.
New South Wales is facing the biggest challenge we have faced since the pandemic started. This is the opposite of where we need or want the numbers to trend.
The highest daily caseload of the outbreak and a warning it will get worse before it gets better.
When overnight you see a number like 29 who've been infectious for all of the time in the community or part of the time in the community, it tells us that in the next few days those numbers are going to go up.
Tonight across Sydney, the Blue Mountains, Central Coast, Wollongong and Shell Harbour, outdoor gatherings are limited to 2 people, not including those you live with. 1 person per household per day is permitted to leave for shopping, and all exercise must be in your local government area.
I appreciate the message I'm delivering today is quite shocking for a lot of people, but I need everybody to be shocked.
This is incredibly challenging times, and I just want to stress that I am incredibly concerned.
Do not leave your home unless you absolutely have to. That is what a lockdown is.
Partners and carers are allowed from Sunday. Funerals will be limited to 10.
There's a lot of funerals that will take place tomorrow. There's a lot of families that are still in limbo. We've had to cancel funerals. We've got funerals on hold. So devastating and so stressful for the families that are already grieving.
I apologise in advance to all those families going through such a difficult time. But unfortunately, we have no option. We have to take this action.
14,000 people now close contacts in isolation. That's doubled overnight. And new exposure sites include Tempe IKEA and Waratah Private Hospital in Hurstville. The Chief Health Officer concerned that new hotspots are emerging.
Sutherland, Kareela, Sylvania, Hurstville and Maroubra.
And further southwest in Glenfield, Narellan Vale and Casula.
Right now here in Greater Sydney as Health Minister, I am both alert and alarmed.
Hospitals are on standby with more COVID patients in intensive care and on ventilators than any time this year. 439 locally acquired cases linked to the outbreak. 43 people are in hospital. That's 10%. 10 of those are in ICU. Worryingly, that includes 1 patient aged in their 20s, and tonight they're on a ventilator.
If we chose to live with this, while the rates of vaccination is at 9%, we will see thousands and thousands of hospitalisations and death.
That means elimination of the virus will trump suppression as other states open up. Streets and testing lines were empty across the city.
I know it's tiring, I know it's exasperating, I know it's frustrating, but we need to keep pushing through.
Tonight, New South Wales is the only state with a lockdown, and the Premier is preparing to extend it for a second time.
And unless there is a dramatic change, unless there's a dramatic turnaround in the numbers, I can't see how we'd be in a position to ease restrictions by next Friday.
Our long lockdown winter set to continue. Charles Croucher, 9 News.
Well, dozens of police have found out across southwest Sydney in a major operation to enforce the stay-at-home order. Communities say they've been unfairly targeted, and today officers found them largely compliant.
Police promised they would be visible. Now they're impossible to miss.
30 cars. 30 cars. 30 cars.
This street in Chester Hill almost had a police car stationed outside every house, a staging point for the stay-at-home blitz.
They're really patrolling the area, all right?
With almost half of the new cases in the southwest, the government says they need to police the rules or more people will catch the virus.
Nobody's suggesting that the people of southwestern Sydney aren't hard-working. What we're suggesting is that there's been low levels of compliance.
So in turn, 100 police from all over Sydney were dropped into Cabramatta, Liverpool, Fairfield.
It's dead. It's ghost town.
At the top of the list, trying to stop people visiting each other's homes.
I think it's ridiculous. I think it's a joke.
People are scared.
But the operation has drawn accusations that police are unfairly targeting certain ethnic groups.
You can't escape the perception, and that is that we are being singled out. Where's the police in Waverley? It doesn't pass the pub test.
A delicate balance to fight the virus, not the people.
Similar decision was made where we pushed police into Bondi recently around the beach area. A similar decision was made not that long ago in the northern beaches when that area was locked down.
But parts of the community are clearly on edge. This in Roselands. But minus a few police, all of the main shopping strips were dead quiet.
Shops closing all around, so we don't know how long we're going to be open for.
The usually vibrant streets of Cabramatta just dull. And at the food markets, it was a few groceries before heading off.
Basically, I just do my stuff and go back home.
What's scaring our doctors is testing numbers are low in the suburbs of concern. It picked up at the Fairfield Showgrounds today, but New South Wales Health is convinced there are a lot of people with the virus they don't know about. More than 2/3 of people over the age of 70 in New South Wales have had their first dose of vaccine, but in that same age group it drops to just 50% in Canterbury, Bankstown, Liverpool and Fairfield. And even with 300,000 additional vaccines on the way to GPs and clinics in the southwest, in the next few weeks, jabs alone won't win this battle. Chris O'Keefe, 9 News.
Let's go to James Wilson in Fairfield. James, police are wrapping up operations for the day, but how did the community respond?
Well, Mark, businesses have been quite receptive to this operation today. We saw police out enforcing these new measures, and it does seem like the message is getting through. There were 87 businesses that were inspected, 51 warnings were issued, a further 8 penalty infringement notices also handed down. Mark, the majority of those were for people failing to wear masks, but thankfully there were no arrests. Now, police are wrapping up their operation for today, but they aren't getting complacent, Mark. They'll be back here tomorrow to do it all over again.
OK, James, thank you. Well, Sydney South has emerged as a major area of concern. Tiffany Genders is there. Tiff, there's been a case at Sutherland Hospital.
Mark, the biggest public hospital in the Sutherland Shire has been exposed to COVID. We understand that a woman turned up to the emergency department with symptoms on Wednesday. It was initially feared she had meningitis, but tests soon revealed she was COVID positive. Now, all hospital staff and patients who came into close contact with this woman have been isolated. The emergency department has undergone a deep clean, and New South Wales Health wants people to know that it is safe to come here. There is a race to get on top of COVID in Sydney South after the suburbs of Hurstville, Sylvania and Kareela emerged as new areas of concern. That message does appear to be trickling through though, because we have seen good numbers at the testing clinics. And if you couldn't get there today, there is good news. There is a Carlton drive-through clinic and a site at St George Hospital that are open until 8 o'clock tonight.
OK, Tiff, thank you. Some of the toughest restrictions our city has seen in a long time are now in force. Lizzie Pearl has the breakdown.
Mark, for Greater Sydney, the Central Coast, the Blue Mountains, Wollongong and Shell Harbour. First, there are limits on how far you can travel from your home for exercise. You must either stick within your local government area or not go any further than a 10-kilometre radius from where you live. And even then, a walk or a workout can only be with one other person unless you're out as a household. Outdoor public gatherings, the same, limited to 2 people, households excluded. Shopping is for food and essentials only. 1 person per household per day can shop and no browsing. And there's to be no carpooling. Anyone you don't live with can't be in your car. You can still leave your home for medical or compassionate reasons, though only 1 carer to a residence, work or study, which can't be done from home, is still okay. And from this Sunday, funerals will be limited to 10 people. It's going to be tough, and at this point, there's no end date for these tough restrictions. Mark.
Lizzie, thank you. Well, the blame for Sydney's escalating outbreak has been levelled at the Prime Minister and his vaccine rollout. Scott Morrison says more Pfizer doses will be arriving on shore sooner as the nation's leaders work to better protect vulnerable Australians.
July 9, 2020.
Everything is on the line here.
Melbourne's first full day of a 6-week lockdown that would last 110 days and affect the entire nation. Exactly 1 year on, Australia's largest city and the so-called gold standard state is facing a COVID crisis. The New South Wales Premier pointing a finger at the national vaccine rollout.
What we're missing at the moment is the doses. We only have 9% of our population vaccinated.
Labor lays the lockdown blame directly at the feet of the Prime Minister.
As a result of a failure to vaccinate.
Prime Minister, is Sydney in the position that it's in because your vaccine rollout has been so slow?
No, you need to keep your systems as tight as possible. We've had breaches here.
And amid the worsening outbreak in Scott Morrison's home city, vaccine deliveries of Pfizer are being brought forward.
That will see us rise to 1 million a week.
Doses due later in the year will arrive in August, with 4.5 million due that month and more from September.
Until that time, we have to be conscious that we will have low rates of vaccination.
The only thing that's holding us back is more access to vaccines.
We're not seeing huge increases at all in spite of the government spin.
The door is being left open for under 40s to get vaccinated sooner, but
older Australians are still the most vulnerable.
22% of over 70s are fully vaccinated. It's 10.5% for the population over the age of 16. But there are vulnerable areas. 23% of the aged care workforce are fully vaccinated. It's 15% in the disability care workforce. State and territory leaders aside from Victoria agreed to mandate vaccines for aged care workers, but only recommend it in the disability sector. And to encourage take-up across the board, a new ad campaign will hit TVs on Sunday. For a Prime Minister who broadcast his mission was to get Australians vaccinated and keep the economy open, the risk of a winter of discontent because of lower numbers of Australians vaccinated risks a darker political future. And Scott Morrison is sticking to his vaccine timeline.
Get this job done as we move towards the end of the year, and indeed perhaps sooner than that.
Jonathan Kersley, 9 News.
A blunt warning today from the Hunter Valley's police chief that there will be lots of cops at next Wednesday's Rugby League State of Origin 3 in Newcastle. Masks will be compulsory, the crowd will be limited, and outsiders from COVID hotspots will be fined $1,000.
What I would say for people in Greater Sydney, so Central Coast, Sydney, Blue Mountains, Wollongong, Shell Harbour, do not come. Do not think you can buy a ticket and come up here and not be caught.
Preparations, the region's Director of Health Protection today declared that holding the game in Newcastle is ill-advised. A state of emergency has been declared in Tokyo just 2 weeks out from the opening of the Olympic Games, I should say. Spectators will now be banned at events across the capital where COVID is out of control.
In Tokyo!
Champion kayaker Jess Fox touching down as organisers declared the Olympics will take place in a COVID state of emergency. She passed the first of what will be a daily COVID test.
Which was negative.
A surge in cases, 920 on Wednesday, up from 260 3 weeks ago. The announcement of the state of emergency was followed by the inevitable. There will be no spectators at venues in Tokyo. The opening and closing ceremonies, swimming, track and field, all in an empty stadium. Tennis star Nick Kyrgios thrives on a crowd.
I'm not going to the Olympics.
Our swimmers in camp in Queensland today were already adjusting to the news.
Whatever situation's thrown at you, you've got to be adaptable, and we've got 2 weeks to adapt to the news that's been given, and I'm sure it's not going to be an issue.
Organisers today got an early test run with no crowds, an empty stadium greeting the torch relay as it made its way back to the capital. Life in a biosecurity bubble, a strict regime of testing, a hit-and-run mission to an Olympics, and now no crowds. Never before has a Games thrown up so many challenges.
Being tested every second day, there's a level of anxiety of like, okay, is it green light or are we stopping? You know, there's always that moment of like, which way are we going on the train track?
Whoever deals with it best could well be rewarded with gold. Damien Ryan, 9 News.
Well, Brits will soon be allowed more freedom to travel, with the UK government announcing those who are fully vaccinated won't have to quarantine when coming back from medium-risk countries. The new rule comes into effect on July 19. Until then, returning travellers need to do 10 days of self-isolation. Well, Ash Barty has become the first Australian woman to reach a Wimbledon final in 41 years. The world number one was near flawless in her semi. She heads into tomorrow night's decider at the top of her game and a heavy favourite.
The weight of expectation on Ash Barty grows with every match. She's showing no signs of buckling under pressure.
Oh, she made it.
Barty blasted out of the blocks against Angelique Kerber, powering through the first set.
Oh, that's classic grass court tennis.
But the former champion was never going to surrender easily, breaking Barty's serve in the second. On the verge of losing control of the match, Barty steeled herself, regaining momentum.
Oh, she's got it.
That put victory within reach, and she didn't falter. Barty moving forward 6-3, 7-6.
She does it. Ash is through to the final.
It's exciting. It was almost a moment of disbelief, I think, more than anything, is that I felt like I played a great level all day today. I felt like I was able to bring some of my best stuff.
The last Aussie woman to compete in and win a Wimbledon final was Yvonne Goolagong-Cawley in 1980. If Ash is to emulate her idol, she'll have to do it without family by her side in London.
I know that Mum and Dad will be sitting at home. It's my grandpa's birthday on Saturday as well, so it's really cool how things just come together and sometimes the stars align.
Standing in Barty's way is 8th seed Karolina Pliskova, who won her semi-final in 3 sets. Until this year, neither Ash Barty or Karolina Pliskova had made it past the 4th round here at Wimbledon. Now the pair are pitted against each other for a centre court showdown.
I'm incredibly proud of myself and my team, and now we get a chance on Saturday to try and live out a childhood dream.
At Wimbledon, Karianne Greenbank, 9 News.
And we'll cross live to London shortly. But now time for a look at today's weather. And Natalia, it was wintry.
Yes, it was, Mark. Good evening. Wet and freezing cold, and we can expect more of the same this weekend. The city only reached a top of 12.1. That's our coldest July day since 2010. A max of 11.4 made today Richmond's chilliest July day in 10 years. Terry Hills and Bankstown also breaking records. Let's look at the Sydney radar, and since 9 a.m, Cronulla has had 5 millimetres in the gauges and Camden 4. The heaviest falls have been in the Hunter and Illawarra, with Nelson Bay picking up 14 millimetres and Bellambi 15. Sydney and many other coastal parts of the state will get more rain tomorrow, plus huge surf and wild winds are forecast as well. I'll have all those details later in the bulletin. Mark.
OK, Natalia, see you soon. Well, I want to show you the New South Wales Health COVID heat map, which reveals the explosion of cases across Sydney. We can also show which suburbs have the most testing. That full breakdown is coming up. Also tonight, why accused wife killer Chris Dawson is going all the way to the country's highest court. The front door of a Macquarie Fields home smashed in with a machete. 4 children hiding inside with their mother. And our news helicopter spots a shark feeding frenzy off Bondi, and they're dangerously close to surface.
Hey Sydney, we know times are tough. But if we all do our best and stay home, we'll get our city, schools and businesses back to normal soon. No matter where you live, please do the right thing. Protect your loved ones and tell them you'll see them soon. Stay home and stay safe.